And in between, my aunt had gotten sick with cervical cancer, stage 4. She passed away, sadly. So I said, you know what, I really want to enroll in school. I want to learn more about the healthcare system. I enrolled into the online University of Phoenix program for a bachelor's in science healthcare administration. I was also working at the time, as you can see to the right, with Care First Health Plan. So working, school, I have 3 children, ages 8 to 13. So it was definitely challenging, but I really felt like I was on a mission at that point. Very challenging to keep the GPA up, but I knew I wanted to attend a master's program eventually. So I graduated with honors, 4.0 GPA. And then my uncle got sick. He got sick, and he had diabetes and, multiple comorbidities. And, his issue with accessing care was his immigration status. So at that point, I knew I wanted to further my education and, go into public health and also really reach a larger population. So I decided, I need to apply for a public health degree, and I was going to look for programs. Losing family members so close to me really did catapult me into this field. I'm first generation. My dad is from Mexico. And the whole time I was in school, I was working full time, and that was definitely challenging. I was really nervous about applying to UCLA. The program is MPH for health professionals. So I applied to APU, Azusa Pacific University, got into that school, but I knew, a couple people very close to me were like, Christina, you worked so hard, you kept that 4.0 GPA, challenge yourself. What school do you really want to go to? And don't you think that you want to make those in-person connections? I mean, you went to school online and you're kind of introverted. Don't you think it's time to kind of expand? So I went online and I checked, what is the application process? What do I need? So I decided I was going to apply. The program requirements: 3 letters of recommendation, 1 statement of purpose, 3 years minimum in healthcare, so working in healthcare, and of course the GRE was required. So I had to prepare for that. Next slide, please, if you can. You can see right here my little timeline. So I hope this is helpful to you guys. So right as I finished my undergrad degree, I decided, okay, I'm going to apply full throttle. I took a gap year. So while I was taking that gap year from school, that whole time in the green, as you can see, I was studying for the GRE. Working full-time, building professional relationships, because as you can see, that little line at the top connects to identifying 3 professional contacts for the letter of rec. So I was doing that, finally took the GRE. I had Magoosh flashcards, I had exam prep books, I had plenty of application writing books, flipping through them, seeing what can help me kind of focus my, my letters. One thing I wanted to mention about the letters of rec: if you're going to ask a very busy professional or like an MD, be prepared to sort of write it yourself so that they can make edits. Because something I encountered was I asked, they said yes, and I was like, okay, what happens next? So that then, of course, after I got my letters of rec, I took the GRE, finished my statement of purpose, passed, and submitted my application. And then, of course, I could breathe a little bit. So I got accepted, really exciting. So the program is Master of Public Health for Health Professionals with UCLA. Program was about 1 to 2 weekends a month, 2 classes per quarter, high academic rigor coursework, but Friday through Sunday, full days, were manageable, especially while working full-time and having a family. I made very valuable professional friendships and, relationships, professional relationships. So when I got into the program, one thing that kind of took me by surprise was that I needed to do either a master's project or an internship. Now at this point, I'm working full time, have my 3 kids, and I, have a nice position and decide, okay, I do not have the resources I need to do a master's project, which is similar to a thesis. I'm going to need to take a leap of faith and do an internship. So here I am at 34 years old, with a group of folks who are a lot younger than me who are in this program, but it was so valuable to me because I gained so much perspective. It was a lot of professional development, a lot of connecting with people, practicing presentations, which was great during my fellowship. Um, Compared to the MPH day program at UCLA, they had to do the same thing, but their requirement was an internship because they were not expected to work at the same time. So fellowship to grants management position. So during my fellowship, I made a lot of, professional connections. I got to know the team. It was great. I finished my hours on time, which contributed to my MPH degree. And then I was, offered a position as a grants manager and was really excited because, it really gave me the chance to serve the Latino, multi-ethnic, underserved population. Um, and again, my grants focus on providing services to the Ryan White population, wraparound services for those who have HIV, oral health, to transportation, to home-based case management. So I'm really proud of that. I have a great team, and I finally, in the first time in my career, I finally have mentors. During my fellowship, I kept asking the question, what is a mentor? How do I get a mentor? How do I find one? Do I send a letter? Do I ask? So I'm really happy about that. Some of the things I wanted to, I hope you take from my talk are position yourself for success. If you want to go for an MPH degree, do your best to work in healthcare. I mean, I know not everyone's going to work while they're going to school, but it would be nice if you had like an internship or if you could work part-time, even full-time. It's very doable. I did it. 3 kids, full-time job, I did it. It's really, I can't tell you enough how great it is to work while going to school because you do make those connections. Also, joining in, organizations like American Public Health Association, they have a really good price for students. And also your resume. So your resume is your currency. Keep it updated as much as possible. You never know when an opportunity will present itself. Have a bio, get a professional headshot taken. When you apply for an MPH, if you're accepted, they are going to immediately want a bio, a couple paragraphs about yourself and what you do, your background, and a professional headshot. There's not only one path after the MPH and to the MPH. I mean, with an MPH, you can be a grants manager, which is a very exciting role. You can be an epidemiologist, a program manager, grant writer. So it's really broad. There are a lot of opportunities, and it's not one path and one size fits all. So I hope you guys, if you have any questions, I'm definitely here to answer.
Thank you so much, Christina. And definitely, if folks have any questions, feel free to chat them in the box, and I'll definitely address them at the end of the presentations. All right, so next we have Manpreet. 1 second. All right, Manpreet.
Thanks, Joanna. Hey everyone, my name is Manpreet Sachdev, and I am so excited to join you all today and share a little bit about my journey in public health. Hearing about Christina's journey actually has been super inspiring, and I think it's really a testament to how much impact you can really have in this field. And I think the best part of public health, from my experience, is that it's so vast, right? And you really have the opportunity to lean into so many different areas and so many different specialties, whether that's clinical, pharmaceuticals, mental health, or so many others. Even the words public health are so broad, right? At the most basic level, it means, you're protecting the health of your population. And that population can be, as small as the people in your neighborhood, or it can be as big as an entire country or an entire region of the world. But either way, you're really able to make some considerable impact. So my journey with public health has definitely not been linear, as you can see from the slide. I started off my undergrad with really not a clear inclination of even wanting to pursue this field. I always knew that I wanted to be in a space where I could see the impact of my work pretty quickly, kind of like that, instant gratification that we all really want. And so in my head, the most logical and straightforward way to do that was through clinical medicine. So I started my undergraduate career in 2013 at NYU and studied psychology and molecular genetics, which gave me a little bit of that clinical exposure from my professors and my academia. I also spent some time volunteering as an EMT, working in the back of an ambulance and getting that hands-on experience. And though the work was really fulfilling and extremely rewarding, I still felt like I wanted to do something more. And so when I was a junior in undergrad, I interned at a company called Health Leads and was a student advocate. Health Leads is a public health nonprofit that partnered with different health systems across the country to address the social determinants of health that keep people from living, a healthy life. And so in that role, I had the opportunity to work directly with patients and their families and connect them to different community or government resources. And so I remember, thinking back, helping families apply for SNAP benefits or connecting them to different after-school programs so that, the parents would have a place for their children to be while they were at work. So seeing the difference that we as a small student cohort could make by just connecting families to different resources was so impactful for me. And so the work that I did with Health Leads as a student really shaped my trajectory into public health. I knew I wanted to be in a space where I could make that community level impact. And so when I graduated in 2017, I joined Health Leads full-time as a program associate. And it was so cool to be in a role where I could manage the program operations for the same program that I used to be an intern for. And so in that role, I was able to work kind of at a step above and develop program curriculum, do some higher level case management, and also create relationships with clinical staff and to help integrate them into our program. I really got that bird's eye view of what it looked like to oversee a program from development and iteration all the way through launch. And so I started noticing in that work that I really enjoyed working cross-functionally with different teams. And I really liked looking at data to inform my next work. So I continued working at Health Leads for about 2 years in an internal facing role as well that was focused more on diversity, equity, and inclusion. And that's actually how I met Joanna, who's our awesome moderator today. And so while I was working at Health Leads, I also started my graduate school career back at NYU and pursued a master's of public health with a concentration in program management. So what I personally really appreciated about my time in grad school was the exposure that I had to different subspecialties within public health. Each professor that I worked with had such a different approach and worked in such a different sphere. Some were in mental health, some were in government consulting, some worked for the New York City health education programs. And so at that time, I was really only aware of social determinants of health because of my experience and my work as an intern. I remember I had this one professor that explained how the same social determinants of health that I had learned about in a hospital also existed in other overlooked communities. And so we spent a couple of classes talking about how mass incarceration is a public health issue that's frequently overlooked, and that they face a lot of inequities as a population coming home from incarceration. And so that introduction and kind of history lesson, in a sense, really opened my eyes to the different avenues of public health that honestly I didn't even know existed. So I'd say through my professional experience, I really focused on building 3 key foundational skills. And those are cross-functional collaboration, using data analytics, and then also utilizing feedback from your community. And so I am really happy to be able to leverage each of these areas in my current work as Senior Associate of People Analytics and Strategy at the Center for Employment Opportunities in New York City. CEO is a national nonprofit with a mission to provide evidence-based employment programs to those individuals who are coming home from incarceration. And so especially right now with the impact of COVID, a lot of federal and state prisons are releasing people from their population. And so my work is kind of making sure that these vulnerable populations have opportunities and have a place to kind of get back on their feet. So my work right now really encompasses using data and using that to engage and strategize some practices to keep our staff and participants supported and engaged throughout our organization. So just in closing, I want to mention, outside of your actual work in public health, there are so many opportunities to continue to evolve and continue to learn, whether that's through just conversation, being involved in your alumni network, or through your volunteer work. And so for myself personally, in the fall of last year, I started volunteering with Posana Health, which is a startup with a mission to create a supportive network for caregivers. And so as the operations lead, I really help with creating a scalable strategy, and I help to plan different virtual seminars and events, most recently ones around COVID. Outside of that, I also recently joined NYU's Alumni Board of Directors last month. And so our goal there is to really keep the public health NYU community engaged, supported, and just providing them with different resources and opportunities to continue to grow as leaders in their field. So I think overall, I would say in my professional background is really working at organizations that address barriers that specific populations face when they're just trying to advocate for themselves. So whether that's needing access to equitable healthcare or trying to get equal work opportunity despite having a justice-involved past. And so I hope to continue to make an impact at the community level, and I'm really, really grateful to be part of this space. But feel free to connect with me on LinkedIn, reach out after the seminar, or of course, chat any questions that you have. And I'm going to pass it on to the next speaker.
Thank you so much, Manpreet. And the next speaker is Astrid Sosa. 1 second.
Hi, everyone. I guess one thing that if you do choose to pursue a career in public health that you will likely learn very early on is how small the public health community is. I actually worked with Joanna for a brief time right after undergrad with health leads, and I see that Manpreet as well worked with health leads. And so, yeah, just kind of interesting. You'll likely sometimes cross paths with a lot of people. And so, yeah, one of the really nice things about the public health community being very mission oriented and fairly small. And so I graduated and received my undergrad in anthropology and international development in 2015 from UCLA. Throughout undergrad, I kind of did not really know exactly what I wanted to take my career. For for a brief moment was interested in, maybe pursuing the pre-med route. But eventually learned that after taking some anthropology classes, I really liked learning about how people and their culture kind of influences the way that they access healthcare and view certain services. And so kind of seeing that interconnection, as well as had a little bit of interest in global health and working for international nonprofits. And so just kind of was interested in that, and in undergrad was involved with a student-run nonprofit organization called GlobeMed. And that was my first introduction into the world of public health. That really piqued my interest. It seemed to be very comprehensive and had a little bit of the aspects that I really liked, just being able to understand different communities' practices and beliefs, and just shift the way that we that healthcare is viewed and access to meet their needs and meet them where they are. And so after graduating, I worked for almost 2 years with Health Leads. And so I was also a program associate, and that was, I think, my other kind of pivotal moment in public health and healthcare. I really understood that there's a huge need for more of a healthcare focus within our healthcare systems here in the U.S. And so those 2 years that I spent working, I realized that I really wanted to be able to work in helping to stand up programs that better help integrate healthcare systems with our communities. And so I knew I wanted to do that in a larger kind of scope, and wanted to be able to be part of the operations and strategy in figuring out how to solve that problem. And so I was born and raised in California, and so I knew that I kind of wanted to spend a little bit of time outside of California. And so I figured, I think, grad school would be the perfect time to venture outside of California. And so I specifically applied to only one graduate school in California, just as a safety net, but debated a couple, and ended up visiting Emory, which is in Atlanta, Georgia. Never saw myself moving to Georgia, but I visited for a brief, I think it's like a welcome kind of prospective student weekend, and really loved the community. The program is very well focused in healthcare management and administration, which is what I kind of chose to focus my time there in. And the students were very well involved with a lot of the communities. And so that kind of aligned with my interest and with what I was hoping to get out of my graduate experience. And so I interned with a couple of healthcare systems out there, with helping them to integrate some technology into their systems and kind of operationalize and make more workflows a little bit more efficient. I also kind of knew that I wanted to pursue a program called Administrative Fellowship. A lot of hospitals throughout the country have administrative fellowships. They're either 1 or 2 year programs, and they're a great way to kind of get exposure to senior leaders and get that mentorship, which Christina mentioned, which I think you all will begin to hear if you have not already. Mentorship is, really important, as well as sponsorship. It's helpful to know, what it is that you maybe need to develop, what opportunities you maybe should start looking at, and things of that sort. And so I knew that that was the next step that I wanted to take in my career path. Administrative fellowships are kind of, the application process is very similar to the graduate school process. You also are required to submit your letters of recommendation and personal statements and transcripts and all of that. And so I did that for a year, moved to Oregon to do that. kind of decided I was a little bit over living so far from the West Coast for 2 years, so kind of wanted to venture back out. I completed my administrative fellowship this past August and have since then transitioned onto a health equity administrative role with a small insurance company in Oregon as well. And what I do with this organization is we help administer Medicaid program to the Eastern Oregon communities, which is a bit more rural and a bit more elderly. And so they have their own unique challenges with transportation and resources being very limited and just a little bit hard to get to and just access in general. And so in this role, I'm helping to develop a strategic plan to help address some of those issues and make sure that we're looking at information and that we're using data in a very smart way, and that we're able to either look at how race and ethnicity may inform just gaps in care and how we can kind of tackle that in different ways, and as well as looking into our community partnerships and seeing how we can collaborate with them to foster stronger relationships. And so, it's kind of, I would say one thing that I would love you all to take away from this, my talk is just kind of, I would say it's helpful to have an idea of what you want to accomplish, what kind of your own mission is. That always makes it so much more easy to figure out, where it is that you want to take your next step in your career. And that has been extremely helpful and very informative for me personally, especially as I, continue to see options and always kind of keep your connections. Again, public health is very, very small, and so you'll likely just work with people who you've encountered before, and just maintaining those strong and meaningful connections throughout your career is so important, and especially help you, because I've had people who reached out to me who I met several years ago, and they found an opportunity that they think I could be a great fit for. And so just be authentic, and always make sure that you're pursuing opportunities that speak to you. Thank you.
Thank you so much, Astrid. And I do acknowledge that we have a lot of great questions coming in, a lot of great questions. So please keep, asking those questions, and we'll definitely get to that at the end of the last presentation. All right, so last but not least, we have Marlon-Ray Velasco.
Hi, everyone. My name is Marlon-Ray Velasco. And so just before I started talking about, my journey, I kind of wanted to just touch base on what, all the rest of the speakers are saying, especially Manpreet, and just saying that public health is so diverse. If you can tell from our past speakers, that we all, all work in different different sectors or different roles. And I feel like that's such a great opportunity with public health, is that, it really opens the possibility and those doors for you, depending on what your area of interest is. So, that's why, like, I've learned, just through their experience, that, public health is so broad. That's what I really want. And I really want to emphasize with public health before, I begin. And also, I like doing events such like these. So, I've done an event in my alma mater for UCI, which we kind of discussed about careers in public health as well. And I really like these kind of events because, when I was an undergrad, of course, I had all those resources such as, resume workshops or interview workshops, or, what does it take to apply for grad school. But I feel like the one thing that I wish I had more exposure of are events like like these where I learned firsthand experiences through people who were in my shoes, or, you know, so I think that's what I really love doing this kind of events, because I want to really connect with, you know, the students, with you guys, and show you firsthand, you know, what it's like to go through these experiences, all these emotions that you're experiencing right now with, you know, with maybe you're starting, you know, undergrad or your post-grad or wherever you are right now in your career and your education, that you can hear firsthand experience. And I feel like that would have been really helpful for me, you know, I want to say like back in the day, I was not that long ago, but, you know, when I was in undergrad in 2010, you know, I wish I had that kind of exposure of learning, you know, through another person's experience, because I feel like that's really great to learn from one another. Next slide, please. All right, so just a little bit of background education about me. So I'm from Buena Park, California, born and raised in SoCal. You know, I love SoCal so much that I stayed and attended UCI as for undergrad from 2010 and 2014. And I actually was a biological science major with the intent of going to medical school and becoming a physician, which I'll explain later on. That obviously didn't happen. I ended up graduating with a bachelor's of science degree in public health sciences. So there were basically two main reasons why I changed years into public health sciences during the fall of my junior year. So first of all, you know, during my first 2 years, my freshman and sophomore year, I'd already satisfied the pre-med requirements, you know, the all those bio classes, OChem, Gen Chem, physics, etc. And, you know, junior year and senior year were mostly for, you know, to those upper division classes to fulfill your major requirements. Well, I took 2 public health, community, and global health sciences as elective courses, and it really fascinated me because I kind of got a different perspective of medicine. You know, growing up, I kind of saw medicine as just a clinician, or, you know, kind of just treating one patient at a time. And through these classes, I kind of learned that it can really be a domino effect, and you can really impact a greater good if when we focus on a community and a global perspective. And that really fascinated me. And I was like, you know what, if I could become a physician to have kind of like, to be like a micro and macro, perspective to medicine, I think that would be really make me a great physician in the future. So that was my plan. And secondly, I wanted to gain experience at UCI through the program in public health. You're required to do a practicum and internship, which the biological sciences department did not offer. And I was thinking long term, and I was like, you know, I should really utilize this resource that my school is offering if they're going to connect me to, you know, and with an internship that's already required, and I'm already fulfilling pre-med requirements. I'm already ahead of the ball game, right? Of getting clinical experience, and, you know, fingers crossed, maybe I'll be even hired, you know, after I finish that internship. And then, of course, I obtained a Master of Public Health with a specialization in health promotion in 2018 from National University, which I'll go ahead and discuss more of how all that happened in my next slide. All right, so as I mentioned, I was initially a bio major with the intent of going to med school. And like I mentioned, I wanted to gain that clinical experience through the practicum requirement under the public health program at UCI. And so I was fortunate, and, you know, stars aligned. I was actually hired as like kind of an entry-level front desk staff for the internal medicine private practice that I interned at. And I eventually worked my way up to be the quality improvement specialist, and also the office manager for that clinic. And I really learned the ins and outs of running a doctor's office, including overseeing our healthcare effectiveness data and information set, or HEDIS performance measures. And these performance metrics are kind of like preventive, you know, measures to, you know, based on demographics on what like specific, you know, individuals should be testing for example, like mammogram at specific age, colonoscopy, those different preventive tests. So I learned really about you know, those quality measures, and I kind of got more fascinated with that. And I'll share a personal story on what really, I think, solidified my passion for public health. So I was working for the clinic and overseeing, you know, our performance measures. And at that time, I was responsible for doing doing like pre-work for the patients before they're coming in, and, you know, doing like the pre-work labs for our clinicians. That way we were kind of like improving efficiency, you know, for the patients. And so what I would do is, you know, based on demographics and kind of you know, outline what they should be testing for based on the HEDIS measures. And so my dad had approached me, and he was like, you know, since you do this, you know, as your job, I went to my doctor's, you know, appointment, and and they gave me a lab sheet, but I haven't gotten labs in like 2 to 3 years. Can you just please ensure that my labs have, everything, like, I haven't gotten everything from, ground up, whatever. And so I looked at his test, and my dad was in his mid-50s at that time. And I realized he didn't have a PSA test. So PSA test is a prostate-specific antigen test that is a screening test for prostate cancer. And he, based on my knowledge, right, of the HEDIS measures, working at the clinic, I noticed that my dad was, in that, that range where he should be testing. So I had asked him, did your doctor perform a prostate exam, a physical exam? He said, no, that I'm healthy, that we can bypass it and do it next year. So I was like, I don't know. I kind of still, I was like, you're in that, that age, and we have history of cancer in our family. You know what, let's add it. You're already going to get tested. It's one more test. It's already been getting done. So he told his doctor that I recommended it, and added it. Found out actually that my dad was stage 3 of prostate cancer. So with my knowledge of HEDIS measures, I mean, like, that was like, I think that was my turning point where I learned, like, I saved my dad's life, essentially. And for me to know all these measures, I really was like, I know as a clinician, I'd be helping like patients, but I was like, I want to do more and do better and help a community and help a global, on a global scale, that like, and help, other people's like fathers, brothers, sister, anyone through the work of like quality improvement and public health. Because, like I mentioned earlier, that's what really interested me, because we, like I said, it's a domino effect, and we're looking at communities in a larger scale, right? Rather than when you're a clinician, it's like that you're the patient you see one-on-one. So that really geared my interest, and I was like, you know what, I think it's a true calling. Like, I'm gonna get my master's in public health. And so I decided to start applying for MPH program instead of pursuing medical school. And as I mentioned, I like that. I figured out that I like that administration side of healthcare that focused on like improving health outcomes by evaluating system processes and delivery of services, which is what quality improvement does. And so when I was applying to MPH programs, for me at that time, this is what I considered, what was, at my time. Of course, it may be different based on the path that you may want or the career you may want. But for me, it was flexibility, accreditation, and cost. So flexibility, I did want to still work full time and gain experience, because I didn't want that gap in my resume when I was applying after after my program. And I wanted, when I was applying, I wanted to show them that I can keep up with school, with different projects, and still, have a, do school and do work, etc. That was like meaningful for me. So I kind of want to look into programs that worked well with my work schedule. And also, secondly, for accreditation. So when I was researching into, grad programs, I was looking that a lot of employers and also additional certificates were requiring a MPH from a CEPH accredited university. So I kind of wanted to set myself up for success. I was after grad school, I was going to apply everywhere. And so I didn't want that one, requirement to stop me from gaining my dream job. And so I was like, you know what, let me just check that off the list. That was one of the things I was looking for when I was, looking into programs. And lastly, for cost. So I didn't know this, when I was in undergrad, my dad took care of all my loans. But when it came for grad school and I was like, talking to an advisor, I did, this is something that I learned new, was that you have actually an aggregated loan limit from the free application for federal student aid, or FAFSA. And so, and I believe it's like around like 130, the cap from undergrad and post work. And so for me, I was like, oh man, like I already have loans from undergrad. And then, if I have a take a loan out for grad school, and, I kind of wanted to give myself some wiggle room or a cushion for in case I wanted to do an advanced degree, like a PhD or a doctorate in public health, etc. I kind of want to give myself some, some loan money amount. So that was kind of, for me, the 3 things that I looked into. And of course, it may differ for, what you may look at your current situation, but I just wanted to share that was like the things that I considered, when applying for an MPH program. And then lastly, how I got to my career. So after I finished my MPH program in 2018, I mass applied, everywhere, and I got a job as a contractor, as a quality assurance specialist who reviewed medical records for the U.S. Department of Veteran Affairs, or the VA. I did that for 1 year, and for that, mostly my role was really just reviewing disability medical reports to ensure that the doctors, examinations were up to par with VA standards. So it kind of went hand in hand with like what I was interested in: quality improvement, quality assurance, quality management. But I really landed my dream job. Going back into my MPH program, I really learned that I really wanted to work. I was like, you know what, my goal is, after learning all these, going through the program, I want to work for the health department, the local health jurisdiction, because I felt like that was the most where I can be most impactful, because that's where a lot of the center of where healthcare is, and at least in your county. And so I was like, if I really want to make a difference and serve underserved populations or subpopulations who may be disproportionately impacted due to, like, for example, HIV, which I work in, I want to really make a difference in those kind of in those populations. So I thought, you know what, the local health jurisdiction is like the perfect place, and it's like basically the forefront of public health in the county. And so I was fortunate enough where I got hired as a quality improvement specialist for the Orange County Healthcare Agency, or the Orange County Health Department here in Orange County, since in the HIV unit. And my role, what I really love about my role is that, kind of going back to what Manpreet and Christina was saying, is that with public health you have so many different options. And in my role, because quality improvement is kind of like the center, you can always have room for quality improvement in any sector. And so for my role, I love mine because it's not my day-to-day jobs vary. So one day I'll do grant writing. We just finished our Ryan White Party application a few months ago. Another day I'll do data analysis. So I'm really using my epidemiology, biostats background. Another day I'm doing a community needs assessment in the community. I'm going out into the community and getting, I'm getting feedback from, the subpopulation of interest for me for HIV. And those are things that you learn in grad school and in your MPH program, and also my undergrad program. So for me, it meant a lot that I know that I'm using the skill sets that I learned in my MPH program, and I'm really doing it in my everyday job. So I know that, my degree wasn't going to waste, or I'm really being resourceful with, what I learned. And so I think that's what I love most about my job, is that I get to wear different hats every day, and I don't get bored. It's not stagnant. I don't get bored, and I get to utilize, like I said, I get to enhance my skill sets that I learned in my MPH program every day, and it doesn't not go to doesn't go to waste. That's about me, and I guess for me, words of advice I would say for everyone is that, as you all meant, with the four panelists, that there's not one path into public health. There's not one correct way to get where you want, and never give up. And like I said, I think I applied over 300 applications until I landed my job. So don't be discouraged if that one application you didn't get in, because everything will happen for a reason. The stars will align. Just keep pushing on, another advice is even if it's just a volunteer internship, that's still experience. So even though you're not technically getting paid, you can add that for your resume, and that's going to help you get that dream job of yours. And I'll give it back to Joanna. Thank you.
Thank you so much, Marlon-Ray. So let me stop sharing. And that concludes the presentation. So I did wanted to, summarize, and we did hear a lot of great points from Christina, from Manpreet, from Astrid, and all the way to Marlon-Ray. Public health is so broad, right? And how do we even define it? And I feel like they did such an awesome job defining it. It could be many different definitions, but at the end of the day, it's really providing access to these vulnerable populations and ensuring that there's equitable care. And with that shared, let's dive into the Q&A. So thank you, Christina. I did see that you answered a few of those questions. Let's go back. All right, so we have a question. How can you link infectious disease with an MPH?
Marlon, you want to answer? Anyone else want to
Go
answer?
ahead. Go ahead.
You sure?
Yeah.
Okay, so infectious disease, you can go into like a specialty like epidemiology, or run an infectious disease program. Hospitals have infection control. You can be a director of infection control, a coordinator, a program manager. There are a lot of options there. Anything you want to add on, Marlon?
Yeah, I think there's adding on to what Christina was saying, I think that, yeah, like epidemiology, and I think really what's really important, and what I said when I spoke at UCI, was that like it's kind of bittersweet right now in this pandemic that we're happening. And of course, it's unfortunate of, how many lives have been lost. But on the flip side, it's really showing the importance of public health, of public health professionals. So like, for example, for me, since I work for the health department, I actually was called on to do contract tracing because I had an MPH degree, because I had those skill sets from my graduate degree that I was using. I was actually asked by the health director, specifically to let your MPH degree is so so important that people will see your MPH degree, and like you'll be utilized in different different sectors that you may not have initially wanted to do. So that's definitely something I feel like you can help with an MPH degree.
Thank you.
I would just add in one more thing to Christina and Marlon-Ray's response here. I think when we've talked so much about how broad public health can be, and even infectious disease is such a broad space. And so I think some of the questions to ask yourself are like, what about infectious disease interests you? So are you interested in, the program, the management aspect of it? Are you interested in collecting data around infectious disease? Are you interested in analyzing the data? And so trying to figure out, where do you particularly see your role and your day-to-day, that will kind of help you figure out what type of roles are out there for you as well.
That's perfect. Thank you so much. And we have a second question. What are the advantages, benefits of finding a job and working with a master's degree versus a bachelor's degree in public health? What are the real differences between them?
Okay, so I can definitely start with that one. So from my experience working with undergrad, with an undergrad degree versus master's degree, I can honestly say after getting my master's degree, I saw my skills, refine and develop and bloom, and I had a lot more doors open for me compared to with the bachelor's degree. I mean, when you go into a bachelor's class, there's it's a lot bigger. And then a master's degree, you have less people. So when you're out there in the workforce competing, that's when it really also helps with the job force. And also you can definitely expect a higher salary with a master's degree and higher level of responsibility too. I mean, you really want to work with these populations and make a difference, a higher impact. Having a master's degree gives you that sort of level of responsibility and opportunity for sure.
Yeah, adding on to what Christina was saying, like definitely, I think in itself, you're getting a master's degree, so you're mastering your field of work, your concentration, and so just knowing that because basically in the master's degree, it's basically if you did take public health as an undergrad, which I did, it's a lot of similar classes, but you're really honing down into like mastering these concepts, mastering these different skill sets. And I think the difference, like as Christina was saying, is a lot of job opportunity. Personally speaking, when I applied after a bachelor's, honestly, like no one was really looking at my application, especially the health department, because they, I wasn't as my application wasn't as strong as those who had a master's degree, because it's kind of showing that, so that MPH kind of really did give me, open the doors for more opportunities for me, and definitely a higher salary. And especially from mine, like example, like I can be pulled into different projects because I have an MPH degree. And the example I gave, that I was pulled into the COVID project because I have an MPH degree. So they know that I know what contract tracing is. I know how to kind of like, the skill sets to, stop infections, et cetera, et cetera. So definitely a lot of opens the door to a lot of more responsibility.
Yeah, and I'd say just to kind of echo what has been said, it's I worked for a little bit right after undergrad, and did also kind of struggle to find that first job. I think it's pretty common, unfortunately, nowadays. And I really enjoyed what I was doing, but I knew that I wanted to have a higher impact and just get more, have more responsibilities. And I started to look into opportunities, and I was looking at other jobs while at the same time thinking about applying to, graduate programs. And I spoke with a lot of people, and sort of the consensus that I was hearing and that I was actually seeing as I was not getting any interviews was that my opportunities would be a lot higher if I went to graduate school, spent this 2 years, and actually, went to class and worked and did my internships through those 2 years. And it definitely has made it much easier now that I've kind of gone through that process to move around and look at other opportunities. So yeah, definitely opens up more opportunities and just makes it easier, especially if you're looking into working into local health departments. They do highly value just showing that commitment and that interest by pursuing that graduate degree.
Yeah, just one last thing that I'd add on here is that graduate school going to graduate school for public health is unique in that you get to really specialize in a concentration, which you may not have the opportunity to do as an undergrad. At least from my undergraduate experience, it's a lot more general or like building that foundational knowledge. And so when you get to the grad level, of course, your courses are more rigorous, but you also are dedicated to a specific concentration. And depending on the school that you're in, that can be anywhere from like 5 to 10 plus concentrations. And so one of the distinguishing factors of getting that MPH when you're out in the market and looking for jobs is that you've done that, extra step, and you have that specialized education in your concentration as well.
Perfect. Thank you so much, everybody. And we do have a question around concentration. So can you discuss the different concentrations within public health?
Yeah, I think most programs have 4 concentrations. There's biostats, which quite honestly, I don't really know the difference between biostats and epidemiology. I think one of them is a little bit, I'm not too into the data side, so excuse me, maybe one of the other panelists might know a bit more. And epidemiology, policy and management, community health, global health sometimes, and there might be another one that I'm missing. But I would say, yeah, there is opportunity to have that concentration. A lot of programs also have certificate programs if you want to specialize even more in, say, social determinants of health, or you can also have the ability sometimes to, even if you do concentrate in epidemiology, you can kind of make your own sort of degree and take classes that are more related to community health. And that way you have a wider scope of skill sets, and you can take, you can concentrate in policy, but also just take a lot of data specific courses. And that way you're also just kind of cross-functional. You can market yourself that way.
Thank you so much.
Yeah, and
go for it, Manpreet.
I was just going to add that, as Astrid said, there are tons of different concentrations, although most schools have those core 4 to 5. I know at NYU, I believe we had 9 different concentrations, so it definitely depends on the school. So I would encourage you in your research to, if it's accessible on the school's website, or even reaching out to the actual admission staff to talk a little bit more about them, about what concentrations they offer, maybe even reaching out to a couple of professors so that you can understand where does your interest fit into a concentration. Because I know outside of the ones that Astrid mentioned, there's also public health nutrition, there's public health management, behavioral sciences. And so there's a lot of different opportunities out there based on the schools that you're looking at applying for.
Thank you so much, both. And the next questions are around GPA. So does GPA matter? More specifically around what steps would you recommend if you have a low GPA?
Okay, so I'd like to answer that one. If you have a low GPA, first off, I would contact the program manager who oversees that program at the school you want to apply, and just kind of get a feel for what they're going to look at. When I was applying, they let me know they were going to look at our applications holistically. So it wasn't one factor that was going to really, really mess you up. I know someone who applied for a master's degree, had a bit of a low GPA, but got in, had excellent letters of recommendation, excellent statement of purpose, and amazing work experience. So he got into a great program, graduated strong, but it's really important to, they're not going to focus on one thing, but it is important to take into consideration, your letters of rec, your statement of purpose. Even if you have a low GPA, I would still apply. And then, of course, if you're doing the GRE, which I think this year there's an advantage that a lot of programs aren't doing the GRE, they also look at the score. So it's holistic.
Thank you, Christina. And a follow-up to that is, I understand you sort of touched based on this with the holistic application, but what would you say is the most important aspect when applying for an MPH, or that differs by programs at different schools?
So can you repeat the question? So what's the most important aspect of applying?
Mm-hmm.
Well, I guess it depends. I think that for me, I wanted to go into a program that was flexible, and also the concentration, again, and another thing, the concentration. So my program um, was community health based, whereas USC's program, which was flexible, it was online, was more global health focused. I wanted to focus on the community, and the program also gave me the opportunity to work full time. So that was like the most important, like how is it going to align with my life, and will I be able to manage it? Again, with the application process, you want to try to keep your GPA as high as possible in the undergrad, but definitely try to keep each one well balanced, the letters, the statement of purpose, your experience. It's not just one thing, but definitely when you're looking, what works for you.
Does anyone else want to add on to that? Manpreet, Astrid, Marlon-Ray?
Yeah, I think I agree. I think just kind of it's nice to, because the programs do vary, and some of them you can think about pursuing part-time or an accelerated program, and so length varies, the content varies. What I think I mentioned, I knew that I wanted to pursue a program that was outside of California, and so that was kind of the scope that I originally was kind of my main focus was the region. And then I was really interested in healthcare management, so one that had a really strong healthcare management program. And I like to kind of always try to think ahead and my next career move. And I knew that I wanted to pursue an administrative fellowship and really go through that management track. And so I knew that a lot of the past, the alumni from my program had previously secured fellowships. And so I figured, they already have that really strong connection. And so it just kind of made sense. And the community was very strong and tight knit, which was another factor for me as I was moving to a completely new state where I didn't know anyone. And so, I think those were my own kind of personal important factors that played into that. But yeah, and I think applications are kind of holistic. And so just that kind of helps narrow down exactly what programs you might be interested in.
Thank you both. And the next questions are around experience. So how do you gain public health experience before applying to grad school? Are there specific programs or internships to look out for?
Wow. So I think for that one, coming from an art background, I had graphic arts on my resume. And I'll be really honest, when I had interviewed at City of Hope, I was at Care First before and it was great, managed care. But when I went to City of Hope, it was more like academia, research. So I really wanted to get my foot in that door. And, on my resume, they kept saying, hey, you have this art background. Where's all your experience? And I let them know. I was very honest. I said, hey, I need to start somewhere, and I'm really interested in working here. I really align with helping others, and um, really preparing for that interview helped me. But definitely internships, fellowships, and if you have to interview a ton to get your foot in the door, um, then so be it. I think I did 17 interviews the summer of my fellowship. And, I got one offer and a fellowship offer, 17 interviews. So yeah, fellowships, internships, asking, professors or contacts, do you have any work that you need help with that I can put on my resume? That's also helpful.
Something that I would add on to what Christina shared is sometimes the public health experience that we think isn't relevant is actually very relevant. And so, of course, I think ideally we think about different internships, different jobs we've had, different volunteer opportunities that we've been part of that have given us some exposure to any and all parts of public health. But I also think there are also your own life experiences that are part of your public health background. And so Marlon-Ray talked a little bit about that in his presentation on how his relationship with health and his family really influenced him to pursue public health. And so I think in addition to thinking about, what tangible experiences you do have, also reflect on, what has your relationship with public health been, maybe in your personal life. And I think those kind of stories, those anecdotes, those things that you can share in interviews are also really impactful, especially when we think about, your interview, your personal statement. It's all about conveying the passion you have for public health across to the other person, whether they're reading it on a piece of paper or they're sitting across from you during an interview. And so it's important to also think about what personal experience do you have with public health that you can also convey your passion for, or something that you learned from, or what skills you kind of walked away with that experience with. And so it's also looking at what are the non-traditional maybe experiences with public health that you may be overlooking as well.
Thank you both. And I understand we spoke about specific concentrations. Going back to that, does it take longer to specialize in a specific public health concentration, or is it already included in the program? Could you please clarify more about the concentration?
I can start off and then others obviously jump in. So from my understanding, concentrations are included in your public health degree. It's not kind of an extra step that you need to add on. So depending on if you're a full-time student, which traditionally takes around 2 years, or if you're a part-time where your program may take 3 to 4 years, your concentration is kind of embedded into that timeline. And so as a public health student, what traditionally happens in most schools is that you start off as a student kind of taking the core public health courses that gives you that foundational knowledge that everyone in that program has to take. And then most often in your second and above years, you decide which specific concentration or specialty in public health that you'd like to study further. And that's where your classes get smaller, you build more relationships with their peers, and you get more of a deeper understanding of your concentration. And as Astrid was talking about, those are like biostatistics, epidemiology, global health, nutrition, so many more. And you really get to hone in on that higher level of study. And so your specialties included in your either 2, 3, or 4-year trajectory as a student.
Yeah, so adding on to what Manpreet was saying, it's definitely, so it's kind of imagine if you're kind of like, you're looking at it as like your undergrad program. So like how I mentioned during my presentation that like during my first 2 years, I was actually in the same classes as like physics majors, you know, bio majors, chemistry majors, because we're all taking the same classes the first 2 years, kind of like what Manpreet was saying, like the core. And then once you get like for undergrad, of course, is your junior, senior year, and then with your master's program is kind of like that second year, then you're kind of like honing down to what you are like your major is, right, or your specialization is. It's kind of like that. So kind of like for, you know, for your master's program, like for example, the first year I took just, you know, basics like epi and all that stuff, but I specialize in health education. So my second year is more health education classes, where my other colleagues who were like say mental health, they're doing more mental health classes. So similar in that undergrad program where your junior, senior year of kind of like those upper division classes, your specialization like your upper division, I guess, to kind of like use an analogy.
Alrighty, so another question that we have is, what is the main difference of going to a higher degree in public health, like a PhD or Dr. PH?
I'll actually answer that because I'm actually in the process of applying. So I think it's perfect for me. The main difference between the Doctor of Public Health and the PhD is, and it goes back to kind of like what we are, the core of what we're talking about is what you want to do in your career. So the PhD is more if you are looking for research based. So if you're really into like the research part of public health, you know, or if you really want to be like a professor in that sense, like teaching and like more of like research based, you would go for the PhD. On the flip side, the doctorate of public health is more of like a leadership. If you're like, so that's the concentration I'm looking for towards, because you know my end goal is I want to work my way up in accounting and eventually be the health director. So a doctor of public health is helping you with that leadership and kind of policies of like, you know, overseeing accounting department. So things like that. If you're looking for like managing a more of like a management of like managing a program or various programs, and the PhD is like if you're looking into researching, you know, different fields in public health and teaching.
Thank you so much, Marlon-Ray. And let's see, would you recommend an in-person over an online program?
Okay, so I can answer that one. I was really wanting to apply for an online program. Again, I'm kind of introverted sometimes and I like to just, you know, get my work done. But someone really close to me said, you really need to get out of that. You really need to understand that when you go for a master's degree, you're going to have access to these amazing professors who are going to have a wealth of knowledge. You're going to be making really good connections with your classmates. So it will definitely be valuable to you if you do an in-person. Just try to find something a little flexible. So I can say that doing an in-person program was very different from online. It was still flexible for me, but I really am glad I did it in person. If I was to do a PhD, though, I would probably do it online. So, yeah, it's flexible. So,
Yeah, adding on what Christina was saying, I think it really just depends on what kind of learner you are. You know, like some people like don't really, you know, like you said, more of the introverted people or who don't really like going to class, or like are people, those people who just are physically there, but like they're going home and they're gonna review the lectures anyway. So like, why should I waste my time going there? So I think it depends on how you know, we're very, you know, people learn differently. So I think it just depends on where you are in your career and like your life right now, and how's that going to, how are you gonna you know, add a, you know, MPH or, you know, program with how your current life is, and actually how you learn too, because some people need to physically like be in a classroom to learn. And for me, like as of right now, like I'm telecommuting because of COVID, and I learned that I really need to be in an office. It's very different. So something like that. So like now I know that like I work better being in an office and telecommuting from home. I need like that different scenery or different environment, and that kind of goes hand in hand with like how you do an in-person or online. This depends on what kind of learner you are, how you're going to grasp the information, because in your master's I'll say it is more independent than in your undergrad program. They're expecting, of course, it's a higher level degree, so they're expecting more responsibility of like instead of whenever things are going to get done. So it just depends on you as a person.
Perfect. So let's go forward with the next question. Can you discuss the differences, if any, and how an MPH is used for someone who only has an MPH alone versus MD, MPH, or DO, MPH?
Well, there was actually, so in my cohort, there was a couple of MDs, actually an MD and a couple of dentists. And they wanted to focus, they were going for an MD because, well, they had their MD, but they wanted to go for an MPH because they wanted to really have that background of public health. And also, depending on like the communities they wanted to work with, I believe one wanted to go into like rural health, and another one wanted to work with like federally qualified health centers. So I think that just having that additional understanding and background is very valuable. But actually, I'm not an MD, so I don't know. But from my experience, that's what I've come to understand.
Yes, and I've worked with quite a few dual MD, MPH doctors at the clinics that I've worked at, and it seems that it's if you do decide to pursue that route, it gives the ability to be able to practice, but also be able to take on other responsibilities and be able to lead kind of higher level cross-regional work. So if you're really interested in that management, but also want to be a provider and a doctor in practice, that is a great avenue to explore.
Thank you all so much. And the next question is, what is the workload like pursuing an MPH? What does a typical day/week look like for you?
I can get us started. So I worked full-time while I was also a full-time grad student, which it sounds like a lot of people on this panel were also in that same boat. I think what worked out really well for me was that the program that I was super, super flexible. And it recognized that many, if not all of their students would be working either full-time or part-time. And so a lot of our classes were offered in the evening hours. And so although we did not have weekend classes, I was able to take all of my credits kind of after traditional work hours in the evening. I was also lucky that my manager at the time was super, super understanding and kind of gave me those flexible hours as well. I would say that same as undergrad, your kind of workload depends on the number of credits that you end up taking per semester. Personally, I did take a full course load with 18 credits, but I do know that it does come down to like person to person. Again, like Marlon-Ray was talking about, what kind of student you are, what environment you kind of excel in, and what studying environment really speaks to you. And so for me, I found that I was probably dedicating like 10 to 15 hours a week minimum to, do outside of classroom studying and learning and projects and doing different responsibilities. And so I think it's really sitting down and mapping out, what does your current schedule look like? So you can understand how much can I, feasibly, and also just like for my sanity, fit into my schedule on top of that. I think right now, obviously with COVID, there's a lot more responsibility happening and there's a lot more things for us to consider. And especially if you plan on being a virtual student, if your program is not yet meeting in person, then really figuring out, what work responsibilities do I have at that time? Do I have any familial obligations? Do I have anything else that I need to kind of know and be part of my schedule so I can understand how much time I have to dedicate to my graduate program? And I think what is great and what you've kind of heard so far from the other speakers is that all programs are super, super flexible. And so you can choose to be a full-time student, you can choose to be a part-time student, and then you can also kind of decide how many classes you are interested in taking per semester. And so I had friends that took, one class a semester because that's what had worked for them. And so from my experience, grad school is different from undergrad in the sense that you can really tailor and customize your schedule to help, fit your responsibilities, fit other things that are happening in your life.
Does anyone else want to add on to that before we move on to the next question?
Yeah, I can. Yeah, I think my workload was also pretty flexible. I think the first year was a little bit more structured because, you are kind of asked to take the sort of introductory courses. And so not as much flexibility there, but the second year was much, I had the ability to kind of pick and choose the classes and my own schedule, took a couple classes with the business school, and I worked part-time throughout the 2 years of my MPH and still had a lot of free time. I even adopted a dog in my second year. So yeah, there is that ability for you to kind of work, get your work done as well, and take some time for yourself as well. So yeah, it's all about you kind of being able to time manage and figure out what kind of schedule you want, and you're able to make that work.
Perfect. Thank you so much. And a next question, I understand you answered this a little bit, Marlon-Ray, but going back to that PhD. So do you think it is better to get a PhD in public health if I'm planning on getting a master's in physician assistant to one day be able to have a leadership position at public health department, or obtaining a master's in public health?
Good question. So I think if you're already getting that master's in your PA, and you want to have that leader position in public health, you can even consider. I know there's some PA schools. I have a colleague that is in a joint MPA MPH program, and what she did is that she kind of getting the clinical of the PA, but on the MPH she did like a healthcare admin kind of concentration. That way, it's showing that you have your clinical degree from your PA program, and then also you have that kind of healthcare admin, leadership position if you want to go that route. So maybe you can consider looking into programs. I think it was Toro University that she goes to in I think it's in Nevada, but yeah, there's definitely programs that that do joint programs, and definitely look into like a concentration of like more like a healthcare admin. That way you can supplement your clinical side with your master's in PA.
Awesome. Thank you so much. And I don't see any other questions, but if I did miss anyone, any folks who asked a question, yeah, there's a comment. Thank you all for coming today and for sharing your journey to medicine/public health. I feel more confident and empowered in pursuing the career master's in public health. So insightful. Thank you, Juan. And definitely. So right now what I'm going to do, if there's no additional questions, I'm going to be posting the survey. And this is a post-event survey. One moment while I get access to that. So by completing the survey, you'll have access to our panelists' emails. They agree to, if you have any additional questions, more specific questions for someone, you can email them and they'll definitely answer any additional questions you may have. So this is the SurveyMonkey link, and definitely feel free to provide any feedback, any insight. And I want to say that that ends our event, but we'll go back to our panelists if you have any last minute remarks, any last minute advice before we end the event. Christina, let's go by alphabetic order.
All right. So take every experience and take little nuggets of learning with you. I've worked in healthcare. All the jobs, fellowships, internships I've had have been valuable to me. So always take something from them and transfer those skills.
I would add, I love that, Christina, that was awesome. I would add that you show up in your everyday life as your holistic self, and so you will also show up as a holistic student. And so as you're preparing for your application, or you're just thinking about next steps in your career or your education, just think about the holistic skills that you bring, and reach out to those that are in schools or in fields or in jobs that you aspire to be in, because everyone, I think, is always willing to share advice and to kind of give back to the community. And so encourage you all to reach out to the panelists as well.
Yeah, and I'd like to add, just kind of, show up and be confident. I think a lot of us, I know I've suffered from this a lot, just imposter syndrome is real and, always kind of creeps up. And so, no, it's just, you have your own experiences, and you being at that table matters, and just don't be afraid to speak up, and yeah, you deserve a seat at the table.
Yeah, and I'll just add to what everyone has said, which is great. I think don't be discouraged. Just keep trying and trying again. Like, don't be discouraged if that you don't get that one job or that one interview. That it happens to all of us. That's like the one thing I really like to tell students is that it's okay, and it's also it's okay not to know right away. You look at our different pathways that led us to where we are. It wasn't like when I was going to my undergrad, I was like, oh, I'm going to be working for the health department. I didn't know that. It's learning through your experiences, and as you get older, and really that's you really know what you really want to do and what really interests you. And so yeah, I say, take it day by day, and just don't be discouraged. Keep applying. Even I think one participant who mentioned about a low GPA, honestly, you never know. What Christina was saying, it's a holistic application. You never know what's going to happen. So as long as I think the best advice I would give is with your personal statements, really be personal. As Manpreet was saying, and really hone down to a really experience that will stand out, and it's not I want to help the greater good, because everybody wants to do that, but make it stand out, that they'll remember you by that story. And kind of like how I shared with you my story, that's the story I shared with my personal statement about why I really wanted to do an MPH program. And I think it's something that really made me stand out even for my job interviews, because that was a story that really holds deep to my heart. So I think that's something, really be personable, look back into what really makes you stand out when you're applying.
Thank you so much, everybody. And just to clarify, so I did get a question. You'll get the emails after you complete the post-event survey, so I'll definitely follow up. So I'll know who completed the survey, and I'll send out the emails afterwards. But thank you, Christina, Manpreet, Astrid, Marlon-Ray, for providing such great guidance and really just providing a lot of great perspective and insight into what it means to enter into the public health career. We appreciate your time, and thank you all so much. And I want to say, have a great rest of your week.
Thank you.
Thank you,
everyone. Have a good night.